It's the show the establishment warned you about.
Oh, hey, thank you for joining us. This is Dr. Tommy Show live from Wesley Chapel, Florida, which is just outside of Tampa if you're not familiar. And I am here today with Tracy, my co-host.
Hello.
We have a special guest on the line, which we'll get to. But before that, I want to tell you about Atlas MD, which is the best medical software for membership medicine practices across the United States and also for any type of direct care practice. And if you're into cash-based medicine, I honestly think that if you don't do yourself the favor of getting Atlas MD and at least giving it a go, you are probably doing yourself a disservice. So go to AskDrTommy.com, click on special offer for Atlas MD, and then you can enjoy the benefits of Atlas MD for free. Just tell them Dr. Tommy sent you. And today Tracy is here with me, but also I have on the phone the president and founder of Sano Surgery, and that's Mr. Dutch Rojas. Dutch, how are you doing today?
Good. How are you?
I'm doing wonderful, sir. As well, I'm glad to have another free market warrior on the Dr. Tommy Show.
Always happy to have that discussion. Love it. Thank you.
Tell us about what you do. You're a surgery specialist. You help people find the best prices for surgery for self-funded employers and I guess individuals too.
Yeah, I think to be as direct as possible, I think what we try to do is we try to help self-funded employers and we try to help surgery centers explain their value proposition. We did that by contracting on the supply side first. So in other words, we helped a lot of surgery centers figure out how to do cost accounting and how to put together financials in order to create bundles. We helped them to understand the relationship between the anesthesiologist, the facility, and the physician. And then we helped them negotiate good implant contracts. And so that's kind of how our business started in 2010. And so we did that, and then we moved on from there. So now we have a nationwide association of bundled payment networks. And, we just try to be a good, consistent help to self-funded employers and try to show them, what the arbitrage opportunities are in the marketplace.
So tell me, why is it that there's so much pushback against what you're doing? Because I think there is.
You know what? The pushback is really subtle. It's not someone, in a big office with a suit on telling me no. What it is I think people are used to doing business a certain way, and they're used to doing it with the bukas. And they don't understand why they need to change.
What's a buka?
And there's really no interest in changing because they're making a lot of money.
What's a buka?
And so we're trying to show them how to be better. Yeah, what were you going to say?
What's a buka?
Oh, Blue Cross Blue Shield, United, Cigna, Aetna.
Yeah, so
the primary four. I'm sure you've discussed it plenty of times on your show.
So basically, the insurance industry, so to speak, the big insurance carriers. Not that there's anything wrong with them, but they have their own self-interest.
Oh, certainly. Yeah. Those guys in the nonprofit hospitals, they certainly, it's interesting. You have to have this conversation with reasonable people. I don't mean that every employee at a nonprofit hospital is a bad person. Some people take it that way, especially when I'm having a conversation with the administrator. Mm-hmm. I'm just saying what you're doing is really, a bad decision. You're really you're not helping the people you intended to help. And that's a disservice to the patient population at large. And of course, the bukas love doing that, right?
Yeah.
Yeah, you're absolutely right.
Well, let's hear something. This is something I saw today. This is from Daily Caller. I just want to have you weigh in on this, and then we'll see what it says. So regarding transparency and pricing and trying to get people the best deal. So we have from the Daily Caller. This is a hat tip to Rob Klein on LinkedIn. He says he sent this and tagged me in it, and it's from the Daily Caller on August 20th. It says, Chief Obamacare Architect sacked after fraudulent billing investigation. I'm just going to play for you what he said.
It's just, you can't do it politically. You just literally cannot do it. Okay? Transparent financing, unless I have transparent financing, also transparent spending. I mean, this bill was written in a tortured way to make sure CBO did not score the mandate as taxes. If CBO scored the mandate as taxes, the bill dies. Okay, so it's written to do that. In terms of risk-rated subsidies, if you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay, just like lack of transparency is a huge political advantage. and basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass. And, it's the second best argument. Look.
So that's Jonathan Gruber, who's acknowledged architect of Obamacare.
Yeah.
So what do you think about that?
Well, at least he decided to tell the truth for once in his life.
Yeah.
Politically, right? You've got a political argument, then you get the healthcare argument, and I'd probably be more inclined to weigh in on the healthcare argument, which is this is a really bad decision. Politicians being involved in healthcare is a really bad decision. The reason we believe in the free market is because we believe that if there's honest transparency and competition between a buyer and a seller, then the best price and the highest quality provider wins. And that's why you're winning. That's why I'm winning. That's why we keep just absolutely destroying the competition, because we're actually providing the lowest prices and the highest quality services possible.
So
but if the American people appreciate that at Whole Foods and Safeway and Apple Computer and everywhere else, why wouldn't they appreciate it in healthcare?
Yeah, I think you're onto something.
I think the super intellectuals like to believe that the American people are stupid, and I just don't believe that. I believe if you give them the tools, the market will figure it out.
What's been the response?
Everybody uses a cell phone.
Yeah, what's been the response to
every piece of technology? Go ahead. I'm sorry.
What's been the response to Sano Surgery throughout when you're going out and meeting with these companies and telling them about all the different things that they're missing out on? What is it more of a shock, or is it more of question, or do they?
It's certainly a shock.
Yeah.
I mean, look, we're sitting with a large Fortune 500 customer. I don't have very many of those, right? Most of our customers are between, I'd probably say 25,000 and 35,000 lives or members.
Mm-hmm.
Of course, there's a big difference, but we start at that number of lives. But we're talking these large companies, and the consultants from Aon and Willis are like, they can't understand where this opportunity came from. They ask me questions like, how are you getting these prices? And the real answer is we ask.
Yeah.
We're not like the insurance companies. We don't tell them what they're going to be reimbursed. We don't mandate anything. We don't try to scare them. We don't do anything. We say, well, what's the price you want to offer?
Yeah, Tracy.
You're the physician in charge. Make a deal.
Yeah, so you're kind of doing on a larger scale what Tracy and I try to do here in the office, right?
Right, I do that all the time.
100%.
So,
but sometimes I'm told that they'll ask me, does the patient have insurance? And we're going to charge them more if they have insurance, but just choose not to use it.
Why would they do that?
I ask the same question. Why would you do that to the patient? Isn't it up to them whether they want to use their insurance or not? But, one case in particular was for a colonoscopy, and they wanted to charge our patient nearly $1,200 more because the patient had insurance and did not want to use it.
Yeah, I think
I don't understand that kind of garbage.
I think
to that point, I don't think there's very many MAs. Look, I love MAs, right? They work in our clinics. I love them. But a lot of them don't know. Neither do nurse practitioners, neither do physicians. I mean, the topic we're having a conversation about, self-insured, free market, physicians understand what a Blue Cross contract is.
Right.
But if I say, well, you can get a contract with this third-party administrator or this captive out of Texas or South Carolina, or, we can do a direct contract with a large employer,
mm-hmm.
We have to teach them that. This show has to teach them. All the free market believers have to teach people how to do it because they have no idea what that means. So I'm not surprised that, the MA that's answering the phone has no idea.
I was talking to Keith Smith once, Dr. Smith out at Surgery Center of Oklahoma. I actually emailed him. I said, well, what is it? He does these, his podcast, and his weekly video podcast was about, basically what you've run into, or what I've run into, we've all run into, this type of inertia that you're talking about, this pushback against changing to a smarter model just because. And I said, well, what is the reason? Do you think that these companies don't want to go to something that's smarter and leaner? I said, is it some type of backroom deal? Is it just relationships? Is it what is it? And he says he thinks what it is basically it's inertia coupled with long-lasting relationships with these TPAs or whoever they're dealing with, these brokers, and then also as an employer, as an employee, as a HR person, there is no real advantage to going out and taking this other model if what you're doing now has just been going along the way it's been. So if you go take this other model, which is new, there's an inherent risk in that because it's different. And there is an opportunity for saving money, but at the same time, there's maybe an opportunity to have it all blow up, and they are not going to be rewarded necessarily if it's some big success. It's just going to be like, well, whatever. So there's a little bit of the comfort and this inertia, this kind of staying the same way we've always done it.
Yeah, and I think you're talking about, he and you, I think, are talking about the demand side of healthcare, right? Mm-hmm. So it's different for why aren't hospitals doing it? Why aren't physicians doing it in private practice? Why aren't they offering bundled, transparent, rates? Versus like what's demand? Why aren't the brokers and consultants who control probably 75% of the market? Why aren't they doing it?
What do you think?
Right. So is that what you're addressing?
Yeah, but what do you think? I mean, you see it from a different side. What is it? What do you think is?
Oh, certainly from the demand side, I think consultants have never done business this way. Uh-huh. Look, everything that Keith Smith started, the guys in California started, with bundled payments as a principled idea for transparency. And competition and free market, I think it's going to win, and I think it'll probably win in the next 3 or 4 years. I also don't think that everybody knows what's going on. So I think, as I talk to the larger brokerage houses, they're getting it. They just haven't implemented it because it's so new. It's like someone getting an iPhone in 2007. Like that was hard for normal people to get a grasp on. Mm-hmm. I think it's just, the diffusion of innovation, whereas everything you're doing with DPC and what you're I think it's gonna be the norm in the next 3 years. I just don't think, other than hospitals, I think the supply side is nefarious. I don't think demand side is nefarious. Like okay. I don't find any, I don't think they're doing anything that I would say is crazy or off-putting. So, I think they just don't understand, and healthcare is slow to move.
So somebody's
physician side and on. Go ahead.
So somebody's out there and they're self-funded, and they basically, if they're working with someone, they're working with a TPA, right? Tell people what a TPA is.
A third-party administrator.
So a third-party
manages the claim for any other services that that the self-insured company wants.
So the third-party administrator then would reach out to these different people who are going to supply them with the healthcare. So they would be reaching out to somebody like you then to find out how you would fit into this employer's plan. Is that right?
Sure. Yeah, we have contracts with. I mean, I don't want to underplay it, but I don't know. There are 400 right around the country, plus or minus, and I think we're contracted with just less than 50. So what does that mean for us? It means that there's an opportunity to introduce our product. All 300 plus surgery centers that we have around the country, plus another 500 plus imaging and lab centers that we have around the country, with free market pricing to those members of that self-insured company. So I think, and there's a real measurable way to see what's the difference between a PPO discounted contract versus Medicare versus bundled rates, right? Like, so we do all that analysis for them. So we show them, like, here in plain dollars and cents, here's what you're really paying as compared to what you were paying. And the real secret is just getting people out of the hospital. As long as they're not, inpatient, as was a long time strategy. And so there's no need for that. So, just trying to get them out of the hospital helps a ton. But I think it's difficult. It's a difficult thing for people to wrap their minds around.
Well, I think it's a difficult thing, and we'll be glad to have you back on to delve a little bit further into it because, as you said, there's a lot of the words we just threw around that even I'm not completely facile with, so like the demand side and supply side and all that. So it's definitely going to be something that we're going to need you to come back on and talk with us again. But tell us about Sano Surgery and how to get in touch with you at Sano Surgery and what you can do.
Info at SanoSurgeryWorks.com, info at SanoSurgery.com. Thanks for having me on the show. I'm looking forward to talking with you again. And for the physicians that are listening and the surgery centers that are listening, we'll take your prices and we'll market them out to our self-funded clients.
All right.
No fees involved. Just send us your pricing. So thank you.
Thanks, Dutch.
I appreciate being on your show.
You're welcome, buddy. Take care.
All right, thanks.
You're welcome. So that's Dutch Rojas, and he's Sano Surgery founder and president. And, this is something that we've always been wanting to find out ways to find people that are going to work with us on doing the type of medicine that we do. cash-based medicine. And I think, like he said, 3 or 4 years, this is going to become the norm where we're all doing similar types of things, reaching out, trying to cut out the excess expense. And I think a person like Dutch and Dr. Smith and Bill Cosart and all these people that we know, and Rob Klein, everybody.
I hope that's the case. That was one thing I was talking to, the person that we met with this morning. It's sometimes it's difficult to refer out.
Yeah, that's what I told her. She said, we had a new patient come in, and she was talking about, there's pros and cons, and there's not many cons with membership medicine or concierge medicine. I said, really, the only con that we have is trying to find partners to refer to.
That's right.
And trying to find people who are willing to even try to take the time to understand what it is that we do.
Mm-hmm. Even just for a simple office visit. I'm going to give an example of the patient that I was getting in, wanted to get an appointment into a pretty big medical clinic. Mm-hmm. And her and her husband choose to be cash payers. They don't have insurance. And I had to do so much harassing. I told her if they knew where we lived, they'd probably come burn our house down because I was such a pest. Mm-hmm. But what a big ordeal that was just to get an office visit.
Yeah, and it's
with a physician, because the majority of those physicians there do not take cash paying patients.
And if you ever walk into a clinic, what's the first thing they ask you is, what's your insurance? Where's your insurance card? Where's your insurance? Where's your papers? And until then, you shall not pass. And I think it's got to be with the way that we're doing things now with high deductible plans and everything. And we need to have more price transparency first, but we also need to have more options for people to use HSAs and things like that. We had a patient come in once that had a tonsils or something, and she said she went to see the specialist, and the specialist saw them for like 2 minutes, and then got a bill for $700 out of their HSA. Well, that particular medical provider doesn't know if it's a HSA, if it's a Blue Cross, if it's self-pay. They just write it out. And so as more and more people start having access to cash to spend, then they're going to want real prices, not $700 for 2 minutes. Nobody's worth that much money when it's just for a simple consult. That's
right. And she, I believe she was reimbursed for some of that money. Mm-hmm. Because she called, and of course that was not fair.
But that was the reflex thing, was to just do that. Mm-hmm. Moving on, we have something about ugly truth about wedding diets, and this is hat tip to Stacy Smith, who is a PA, and she's getting ready to be married here in a couple of weeks. So good luck, Stacy! Congratulations. And she had this. She was reading through this article about wedding diets, and it says, this is from Kelsey Miller, The Ugly Truth About Wedding Diets, and she writes, the bridal industry is kind of a bubble. After getting engaged last year, I stepped into it and quickly discovered that reality in here is a little different. In the bubble, color coordination is of the utmost importance, and $3,000 is a great price for a dress. Everything is to the extreme, more expensive, but somehow less advanced. In reality, for example, the world diet is considered passé. People don't do it. Of course, they do it under the guise of another term. Call it cleansing, call it eating clean. But now we also know that dieting generally does more harm than good. So there's this article about some of the diet plans, and one of the diets that caught my eye, they were talking about different diets, and it said that drinking water was the most commonly reported weight loss technique among women in the study. Crash dieting, of course, is considered unhealthy, ineffective, and simply outdated. And then there's this. One glaring example happened in 2010 when none other than the New York Times reported on a hot new dieting weight loss plan, the KE diet, otherwise known as the feeding tube. The story followed bride-to-be Jessica Schneider, I believe that's how you say it, who spent 8 of the recommended 10 days on a nasal feeding tube, during which she subsisted only on the carbohydrate-free 800-calorie KE diet powder mixed with water and passed through the tube down her esophagus into her stomach. It was an outpatient procedure administered by Dr. Oliver De Pietro, the first doctor to bring the KE diet to the U.S. Using this method, Dr. De Pietro says that patients can lose up to 20 pounds in 10 days. I get a lot of brides, he told the Times. So that was in 2012.
What do you think about that?
I think that's a very effective diet, probably. It is probably as effective as the diets that you hear about where you're going to lose 50 pounds in 50 days or 40 pounds in 40 days. And they say, all you have to do is come in, we'll have this special thing that analyzes your body and all that, this, that, and the other. And You'll also get 500 calories a day diet.
But there's no pills.
No pills, no shots,
injections.
none of those crazy shots or pills. All you have to do is have our whiz-bang technology plus our added little side note of 500 calorie a day diet, and then voila, you'll lose weight.
I cannot imagine being so stressed out about my weight prior to getting married that I'm going to go let someone stick a tube in my nose every day.
Are you shaming people who are stressed out?
Yeah.
Are you
honestly when it comes down to...
Are you bride shaming? Are you thin?
Sure, call
concerned
that.
thin bride shaming people on the Dr. Tommy show?
Sometimes I do that. And you know what? It's their business if they want to do that. And if they want to pay a physician to do that, then honestly, it's their business. I could care less.
We should
Would
start
I do
doing
it?
that.
No.
Could we start doing that?
You want to put down NG tubes in patients?
Well,
how about we just put a G tube in their side and...
Well, what you do is you put it in their tube, their nose, you put a little stuff on it, and then once they start going, you tell them, swallow, 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 and then it goes down. I remember that from residency. I saw the nurses do it.
And they're going to do that.
And then we'll give them some
for 10 days so they
KE
can lose
diet.
They should. Here's an idea. Just buy the size dress that fits you.
Well, or the idea is to
or maybe just
exercise and plan and eat a reasonable diet and compromise on what you're going to look like. But I think that would be too hard.
Well, we know from experience that, I mean, personal experience also, it is difficult to watch your calories every day and eat right every day. And, you know, I don't exercise near as much as I used to, but putting an NG tube in my nose every day just so I can lose weight for a wedding and then blow back up after.
What do you think the best diet is?
For me, what has been the most effective for me is calorie counting.
Okay.
So I I did MyFitnessPal for quite a while, and I've slacked off, but I did MyFitnessPal for quite a while, and I stayed on a certain amount of calories every day. I kept a log of everything I put in my mouth, and that was the most effective way for me, and that included carbohydrates, but I kept my protein at 40%. My fat at 30 and my carbohydrate at 30.
I like the no fat or no sugar, no carbohydrate diet.
I know, but I like carbohydrates.
I hate them.
You love them, but they're not good for you.
I like meat.
Yeah, you do. I could honestly go without eating meat. It would not bother me if I did not have meat for a month at a time. It's not a big deal to me. Yeah. But I know it's better to eat meat than eat carbohydrates, clearly.
No, the other diet that's the most effective diet?
What?
The reasonable diet. The reasonable diet. The reasonable diet is a diet that you could potentially do long term.
Well, you know what's
that's the most effective diet.
You know what I think is I think I've done a lot of diets over my years. Weight Watchers. Weight Watchers, I think, is one of the best diets. And it's not a diet; it's a lifestyle change. And you can eat everything and anything. Just it's all about moderation.
Yep.
So if you want to eat a candy bar that day, you take your points for that candy bar, but that means you're going to be giving up lunch or dinner, something. There's a compromise, and it's effective.
And then you could also go on a medical weight loss. We do medical weight loss here. You use phentermine short term. It's very effective. We use MIC combo, which is a vitamin shot that you can get for energy and also to help you with a little bit of metabolism improvement. And that's got methionine and acetylcholine, B6 and B12. And then you can use that too.
I do like MIC. I do think it makes me feel good. And some patients will say, I don't really notice a difference.
We gave one to our patient that was been on antibiotics for a month now from a problem. And then he said he texted you within an hour and said he feels better.
Yeah, he said he felt a world of difference.
Yep.
But I do like the way it makes me feel. And some patients, sometimes they're like, oh, I don't know if I feel any different. But then they'll stop and then they realize, oh, wow, it does make me feel good. I like it. We've been doing it for 2 years?
Yep. So more than that, probably.
Maybe. But anyway, I like MIC.
A few other things here, but we're running out of time, so we'll just cover those next week. But for all of you listening out there, we appreciate it. For you watching, we appreciate it. Subscribe on YouTube. Send it to your friend to subscribe on YouTube. Also, subscribe on iTunes or Stitcher or TuneIn or however you're listening on SoundCloud. And then for all of you out there who are fans of this show, you know that we have a song of the week, and this week in honor of our brides is the Georgia Satellites. Keep your hands to yourself, and until next time, follow us on AskDrTommy.com, and bye-bye.